Alright, okay, so hello dears. Ayan, hello, okay. And welcome now to the second video, the continuation of our lecture on Salmonella serology. And for this lecture, we're now going to focus on the different methods, laboratory methods, to diagnose your Salmonella infection, especially typhoid fever. Okay? Alright, so of course, the gold standard talaga for any bacterial infections or bacterial diagnosis or identification, except bacteria that produce toxins, it's culture, always culture. And for this typhoid fever, mga good dears, or for Salmonella, the best specimen is blood. Okay, I don't know if na-mention it, but for specimen collection for Salmonella, the best specimen, is blood, followed by urine, and then last ang stool. Okay? Because blood is mas ma-detect ang imuhang Salmonella dito. Okay? And I think ang best pa talaga is bone marrow, if I'm not mistaken. Okay? For typhoid fever, diba? It can disseminate, no? It can reach your other organs. Okay? So blood. Kaya here, naka-specify na culture blood. Okay? Next, serological testing, which is what we're focusing in this lecture. You have first the febrile agglutination test or the Widal test. Okay. Next, you have which is your slide method, could be qualitative or semi-quantitative, and you have the tube method for the Widal test. And you also have the Typhidot, and lastly, immunochromatography, which is what we're going to focus or discuss in the next slides. And of course, the most sensitive and most accurate pag yun and most specific is your molecular methods, PCR. Okay? Alright. Okay. Alright. Now we start first with the first serological test, and that is your Widal test. Your Widal test, by the name itself, is devised by Frank Widal in 1896. It's very early. It's the first test that was invented to diagnose or to detect typhoid fever or Salmonella infections. It's a febrile agglutination test used to diagnose typhoid fever in developing countries. So it's a febrile agglutination test because it uses, medyo excited, okay? So it's based on the principle that, of course, patients infected with Enterica, serotype Typhi, and paratyphi will develop antibodies to the O and H antigens of these pathogens. And although it's simple to perform, it's difficult to interpret, and it requires a detailed knowledge of the patient's medical, travel, and vaccination history. So, naakay mag-correlate ka between the patient's history and the results. Although it's simple to perform, pero it needs practice, or you need to train, or you need to study for it to be interpreted. Okay? For interpretation. Alright. So for the Widal test, the principle is direct agglutination. Ayan. So febrile antigens, meaning I like to think about it as febrile antigens. They're coming from your Salmonella. These are antigens that came from Salmonella, and they are standardized, made into a suspension, prepared for the rapid detection and semi-quantitation of your serum antibodies developed during the acute stage of the disease. And of course, antigens agglutinate in the presence of the antibodies in the sample tested. That's why it's direct agglutination. It's because the antigens are naturally found on your bacteria. So it's febrile because these are the antigens that are found in a way, or that can cause fever in a way, if I'm not mistaken. Febrile, febrile meaning it causes fever. Okay, so febrile antigens. So these are febrile antigens found on Salmonella. Okay, so for your reagents, it contains both Salmonella O, somatic O, and the H antigens. Your positive control, it's a polyspecific, meaning antibodies that can agglutinate a lot, okay, that can react with a lot of antigens. And the negative control, a buffer without your antibodies. Okay, alright. So anti-O or anti-H in the patient sample, so you're detecting if your patient has antibodies to O and H, plus your killed Salmonella O and H antigens. So yeah, it's febrile, okay, so it's a killed siya na Salmonella that contains the O and H antigens. So they will of course form your lattice formation and then leads to visible agglutination. Okay, alright, so very simple lang ang principle. So example here are mga rings, no? So this is O, meaning the O antigen, and H antigen for Salmonella typhi. So na may agglutination, so therefore it's S typhi O positive and S typhi H positive. For AH, meaning paratyphi A, H antigen, so positive po siya in agglutination, and B, paratyphi B, H antigen. So positive din siya for serotype paratyphi BH antigen. Okay, hindi na siya greenhouse ha, BH. Hindi po rin siya alcohol. Charot. I know miss na mo campus. Hindi nga na po sa campus, sa AH. But anyway, dahil mga bet doon. Kaya na like maglakaw ka no, sa first floor. It's the melting pot yun in Siliman. Ang AH. Naganjo ka yung college. Dito dyan ang different colleges magtapok tanan. And sabak tanan, mga senior high. Joke lang. Or like, daming bet talaga. Like, mag-walk ra ka sa AH. Di ka na pa dyan nature, so fresh. Yung feeling, and then pag-agi sa AH, pak! Dala akong crush sa pol side, dala akong crush sa site, dala akong crush sa PT. Charot! Ang dami, engineering, yes! Check. Okay, wala. Coming out. Okay, anyway. Mark, yes, yung pagkabiga ako. Charot. Okay, alright. Paratyphi A, di ba? So, nasa label daan. So, AH, BH, okay? And of course, you have the positive control and the negative control. So, that's for the Widal test. Again, although it's simple to perform, but you need to correlate pa with the interpretation of the results with the patient's history and medical history, okay? Travel history, vaccination history, okay? Alright. Now, for the Widal test, significant finding, 4-fold increase as always. So, 9-4-fold increase from the sera no, of the patients in the acute phase of the infection and convalescent. So, if 9-4-fold increase, then that's significant, okay? So, 10 to 14 days apart. So, you're looking for antibody titer. Okay, so you test the patient sample on the acute phase of infection, and then after pila ka days, you then test it, or you extract your patient sample and test it in the convalescent area, or in the convalescent period. Okay, alright. So sensitivity and specificity of Widal test in the Philippines. If imong agglutination is anti-O and imong cutoff, imong titer is 1:160, the sensitivity is about 72.5% and specificity is 57.5. And if you increase it at 1:320, 2 folds pa rin, sensitivity decreases, specificity increases. Whereas for tube method, mas ano dyan ang tube method, because as you can see, the sensitivity and specificity are high, even if it's at low dilutions. Okay, so ang titer ani 2018. So at this dilutions pa lang, you can already detect the anti-O or the O antigen. Okay, so very very sensitive and specific if sa tube method ka magamit. Okay, for the Philippine setting. Okay, alright, and so that's a Widal test, febrile agglutination test. You're looking for the antigens. You use killed Salmonella O and H antigens. Okay, so you're looking for if the patient has antibodies to the O and H antigen. Okay, alright, that's for Widal test. The next test is your the Typhidot test. Your Typhidot test is a qualitative test which determines still the same antibodies to an OMP, outer membrane protein, found on the outer surface of your Salmonella. So you're detecting IgM or IgG. So it's a complex assay which requires additional steps in preparation. It's a useful complementary test to blood culture and the Widal test in the diagnosis of typhoid fever. So pwede siyang complementary test lang yun. But it's not used as screening test for all febrile illness and should be limited to those with high clinical suspicion lang of typhoid fever. So when we say febrile illness, again, those that experiencing mga fever na mga illness talaga, presenting with fever, ganun. Okay. So if you, Typhidot should not be performed in all, but only those patients that are suspected to really have typhoid fever. Okay? Alright. Okay. Alright, so again, principle is dot enzyme immunoassay. So anti-OMP, which is what we're detecting, no, IgM or IgG, will be captured by the OMP antigen that is dotted on the filter paper strips. And when enzyme labeled anti-human globulin, diba, enzyme immunoassay are attached and then the substrate later on after the attachment of your reagent, enzyme labeled reagents, you add the substrate and then of course a colloid reaction will occur and now that is what we observe. Okay? Alright. The reagents are sample diluent, washing buffer, pre-diluted, enzyme labeled, again, reagent, anti-human IgM and IgG, your substrate A and B, positive control, and of course a negative control. Okay. So, in your filter paper strips again, diba? You have the antigens here, kato OMP, na antigen, diba? And then of course, you then add, diba, your serum which contains the IgG pa, or the IgM. Star na ako guys. Sorry, di ba star-like siya. And then of course, you then add your AHG na reagent with enzyme. Diba? And then you then add the substrate, diba? Then more react sila, which will give a color reaction. Okay? So that's for Typhidot. Okay, so it's a color reaction. Ayan. So positive result, IgG and or IgM, visible reaction of an intensity equal to or greater than that of the control reaction on the commercially prepared filter paper. So you have two filter papers here, napausa din for the control, positive control and negative control. Okay? Alright. Ayan. So here are the expected results. So kung color blue tanan, okay, or night color tanan, then that indicates an acute infection. Diba? Kabati mo, bahalang IgG, it's still included in the primary response, diba, ang IgG. So bahalang acute infection pa lang siya or bago pa lang, positive yun siya ng IgG Japon. Okay? Alright. Because again, appeal mo siya sa immune response. Alright. Now let's say if kanirang left circle or kanirang night color, so it means it's acute infection rate yun kay IgM man ang positive. Okay? Next, kung diri sa left lang positive, that's IgG. Past infection kay IgG na may positive. And then lastly, if walay color ang duha, then that indicates negative. Okay? Alright, so that's for your Typhidot. Okay. So, dot enzyme immunoassay. Okay. Alright. So, you may be thinking, sir, ano ba yan, diba? Duha ka buo, blue. Yung acute, bahalag niyang IgG, yung positive po siyang IgG. Because again, in acute infections, primary immune response, diba? The IgG will also be positive, diba? IgG is also there, diba? But late lang siya mo-increase, diba? Pero it's there in the immune response, alright? And in this case, since positive man silang duha na may color ng duha, then that indicates acute infection. Kaya kuyog man ang IgM. Pero if kanina sa sunod na mga usa-usa lang ay positive, then of course, ma-interpret na okay, if IgG lang yun ang naa, then predominant na siya, meaning past infection na siya immunity. Pero if IgM na naa, then of course, it indicates acute infection, bago pa lang siya. Okay? Alright, ayan, sige. Okay, that's Typhidot. And for the last test is of course your immunochromatography for the kits. Okay, this is based from the manufacturer Rezon Diagnostics International. So it's an assay again. We detect antibodies pa rin to Salmonella, the OMP antigen of S. typhi. So in the outer surface again of S. typhi, it has protein, no, or antigen known as the OMP, outer membrane protein, and we detect your antibodies again in human serum or plasma. So the intended use lang is in vitro diagnosis of typhoid fever, and the results obtained should not be the sole determinant again for clinical decision. The doctors, again, it's in the hands of the doctors kung unsay ang buhatan sa results. Because again, it needs correlation pa with the symptoms, history, and etc. Alright? Kaya medtechs, again, we don't interpret results, although we already know what are the possible indications or meaning of these results. But as medtechs, we don't interpret, okay? We don't make the final diagnosis. It's up for the doctors. We can help the doctors interpret, but it's not our final call, okay, to make the diagnosis. It's the doctor's responsibility, okay? I have to emphasize that, okay? Alright, ayan. So for immunochromatography, again, specific S. typhi OMP antigen, immobilized onto cellulose nitrate membrane, and then you're looking for anti-OMP. Okay, sige namin chika, pero for the drawing, para mas makasabot, ayan, so the OMP antigen, again, is immobilized in your test system or in the test band, okay? Ayan, so for IgG, so different na IgM and IgG, okay? And then, of course, on the control line, it contains rabbit anti-mouse IgG. Kaya siya yung capture, di ba, sa mga existing agents din nakita. Okay, so let's say you have the mouse anti-human IgM, gold colloid, okay? And you have the mouse anti-human IgG. Okay, so depending again on the sample or antibodies found in the sample. So let's say you have both IgM or IgG. So of course, the flow of assay direction is towards here. Okay, so this IgM, of course, will bind here with this mouse anti-human IgM, gold color, diba? It's anti-human IgM. So, i-capture ang IgM. So, pag-capture sila, may siyang complex. So, pag-move nila dili, ma-capture ko siya sa inyong OMP antigen that was immobilized in the test line, diba? Yung i-capture na complex. So, therefore, pag-add sa substrate or pag-ano sa substrate, then, mahimo na siya, magbutang siya ang color or nanay color na mag-produce. So, nanay color na mag-produce sa test line. And of course, the excess, and for IgG, still the same procedure, diba, yung i-capture. And the excess reagents, this one and this one, will be captured by your control line. Kaya na siya antibody dito. Antibody that will capture to the remaining or mga wala na bind na mga reagents na yung anti-human IgM colloid, so mga antibodies pa rin, diba, i-capture. So, muna na-adjure color, sige control line, di ba? So, as we've discussed in immunochromatography, di ba? Sa labeled immunoassay, sana na-gets na. Alright, and of course, the remaining here sa absorbent pad, mga unbound mga reagents, dila mabuta. Okay? Alright. And then, of course, for interpretation, positive result, visible pink purplish band on the test region and the control region. Ayan. So, these are your positive results. So, for positive sa second one, IgM and IgG. So, positive ka. So, you both have IgM and IgG. So, it could be acute infection. Here, positive lang kag IgM. So, acute infection good. IgG ra kag positive diri. So, that's a past infection. Negative is wala yun sa test line. So, control right na negative. And of course, as I mentioned, it's always invalid if wala yung control line. Okay? It means that your reagents are not working properly within your test kits. Okay? So the test kit for Salmonella, for IgG, IgM, okay? Usa ka test kit na naiduha ka buo nag-detect. Okay? IgM and IgG. Alright? So I hope na-gets sila. Alright? I think this is what we're going to perform. I think in the lab or katong Widal test. I'm not sure lang. I'll have to ask. But yes, so that's for immunochromatography. Again, emphasize lang in interpreting results in immunochromatography. You cannot interpret results in immunochromatography kits if walay line ang control line. Because that would indicate na invalid yung test result, guba yung test kits, the reagents are not working properly. Okay? Alright, kaya. And that's the end of our Salmonella serology. Again, it's very straightforward, very dali lang, medyo konti lang na chika. Alright, and that's the end also of our activities in IS. I hope lang yun that you were able to appreciate our lab activities even if wala dyan mo yung hands-on activities. Sa inyong internship, I know you will be exposed to this na. And I hope I was able to discuss. No? As I mentioned, I've been very honest with you, dears, that IS is really one of the subjects that I consider that it's my weakness talaga. My Waterloo, di ba? Waterloo, yes, my weakness. Or it's not something that I'm really confident about. But, again, I did my best talaga to really explain them, the concepts. Bahalag unsa siya ka-complex, bahalag unsa ko kasabaw, usahay, bahalag unsa kalisod, usahay, if di nyo masubstance, I really apologize for that. But I really hope lang yun na namin ang gets. Again, my ultimate goal, whatever class I handle, whatever subject I teach, is that at the end of the day, at the end of the semester, my students will be able to retain something, and that you will take this with you wherever you go, especially when you go to board exams and your internship pag yun po. Alright? And yes, I think napatay the remaining lectures yun mga miscellaneous topics na wala na yung lab activities, lectures na lang on the serology of other mga diseases. But I hope mahuman lang yun ta. Alright, so more siya, dears, and I'm really thankful good ko na you were able to watch this, no? Mga very hard lectures, malagay nyo times 2 na rin ang speed kung nagdali na mo, okay? But I hope lang yun na mo na-retain and alam mo na-understand, okay? So thank you so much, dears, for watching, no? I'll see you on the next pre-recorded lecture, mga last na lang if napagani, alright? And thank you for watching, have a great day, and always keep safe, alright?